In this series of educational videos on Medicare Made Simple, we're looking at when to enroll and how to enroll in Medicare Parts A and B. Well, my name is John Deshawn. I'm a financial advisor with Solera Asset Managers and Insurance Agency located in Roseville, California, just outside of Sacramento. We're a local independent financial services office. I've completed the American Healthcare Insurance Professional certification, and I'm certified to offer both Medicare Advantage and Medicare Supplement plans. I'm licensed, contracted, and appointed with several of the major national and regional carriers of Medicare plans in California and other states, so I can offer my clients several solution choices. But first, for compliance purposes, we must inform you that this course is not affiliated with, nor is it endorsed by any government agency or the federal Medicare program. It is purely for educational purposes, and there will be no offer to buy or sell any products. Each situation is unique, and you must consult with a licensed agent before making any decisions. We are only speaking today on enrollment, but for detailed explanation on all the other parts of the Medicare world, you can check out our other videos. Before we dive in, let's briefly review some of the basics of the government-sponsored Medicare program. There are two parts of traditional Medicare offered through the federal government, both Parts A and Part B. Starting with Part A, through the brief overview, hospital insurance. This helps to pay for hospital stays and inpatient care. Part B helps pay for doctor services and outpatient care. Think of this as primarily helping with the cost of your medical care outside the hospital. Part C is Medicare Advantage. It's an alternative to original Medicare and offers another way to get your benefits. Part D is a prescription drug coverage. An easy way to think about this is D for drugs. Now remember, drugs are not covered by original Medicare except in select circumstances. And Part D plans are available as a standalone plan or are most often included as a part of the benefits of Medicare Advantage plans, what's known as Part C. Medigap. Now, it's not Medicare, but Medicare Supplement Insurance, or also known as MedSup, is offered by private insurance companies and is a common way to help to pay some of the out-of-pocket costs, the gaps that come with Medicare, like deductibles and coinsurance. Now, for more details on any of these topics I've already just briefly mentioned, check out our other videos on our website below. Well, okay, let's take a look at the various enrollment periods of Medicare. When to enroll in Medicare? Most people first enroll in Medicare during their initial enrollment period, what's known as an IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months after. If your birthday is on the first of the month, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to a disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You are enrolled in automatically in Parts A and B if you're receiving Social Security or railroad retirement benefits at age 65. You'll receive your Medicare card in the mail as well. Otherwise, you need to sign up yourself for Medicare. You can do that through your Social Security office. Now, most people will want to enroll in Part B at the same time, but it is not free like Part A is. So you may refuse to delay your Part B enrollment and just take premium-free Part A instead. This will be a good idea for those of you who are already covered under an employer plan as far as your health care. However, some employers require you to take full benefits, Part A and Part B, at age 65. Medicare Supplement has its own open enrollment period. You must be enrolled in Parts A and B to be eligible for a Medicare Supplement plan. You are not subject to medical underwriting for the first 6 months after you enroll in Part B at age 65 or older. You can still apply for a Medicare Supplement plan after that 6-month enrollment period, but you may be denied coverage or charged more based on your health history. Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B, and Part A if you haven't already. You may enroll in a Medicare Advantage or a prescription drug plan, but just for the first 2 months. If you're working past 65 or thinking about it, check out our video, Working Past 65, with a lot of helpful information on that. Now, Part A, Part B, and Part D charge late enrollment penalties. The Part A penalty really doesn't affect many people because Part A premium comes to you at no cost if you've worked in the United States for 10 years or longer. The penalties for Part B and Part D could apply to more people. The Part B penalty is an additional 10% of the premium for each 12-month period that you could have had Part B but didn't, unless you qualify for a special enrollment period. Now, you may pay the penalty for as long as you have Part B. The Part D penalty is an additional 1% of the current average plan premium for each month that you're late. You pay the penalty for as long as you have Part D. So you want to avoid late enrollment penalties. As mentioned, you could be automatically, or you should be automatically enrolled in Part A if you've been receiving Social Security or Railroad retirement benefits when you become eligible and you're receiving your card already in the mail. If you haven't received benefits, you need to go to enroll yourself. Go to ssa.gov/Medicare to enroll online, or go into your local Social Security office. So when you go online, it's going to look like this: www.ssa.gov/Medicare. This is what the screen looks like currently. Of course, graphics can always change depending on how Social Security Administration changes them, but this is what it looks like today. So you want to select the Medicare Enrollment window in the bottom right-hand corner currently. It's circled in red for you here, and we pointed an arrow to it. You will drop down a few screen lengths until you reach How to Apply. Then select the blue window, Apply for Medicare Only. So it's not related if you don't want to start your Social Security income. This is strictly for applying for Medicare. You will read this document and then select I understand at the red arrow that we've selected there for you. At this point, if you don't already have a My Social Security account, you will need to go back to the home page and open a My Social Security account. Now, once you've done that, then you'll be able to select Start a New Application. You will be able to select whether you want to enroll in Part A or Part B, or whether you want to start enrolling in both of them. This is how you'll start to get there. Now, your healthcare needs vary greatly based on your personal circumstances. We do these videos for a couple different reasons. First, and most importantly, we want to be a resource to you and clear up any confusion you have about the whole subject of Medicare. Secondly, we'd love to be your guides on this journey. You can check out our other videos or get more information detailed on the subject of Medicare. If you have questions or would like to schedule a virtual chat with us, here's my contact information. On my website, you'll be able to select a link that will take you right to my calendar and plug in a time that you either want to talk on the phone, do a video chat, do a screen share like we're doing now. We are independent insurance brokers and we're specialists in Medicare. Our service to you is always 100% free of charge. We've helped many people just like you through this difficult circumstance of making a decision, and we'd love to help you. Thank you for taking your time to watch this video.